Guys, let's go. Okay. Mazen, can you remind me next break? Who do I need to talk to? I'll talk to Tasneem. Just remind me to talk to Tasneem so I get a list.
Remind me so I can remind you.
And you remind me and I'll remind you. Keep going in circle.
One of us will remind the other.
Inshallah. Yeah, this reminding thing is getting old.
Oh my God. That's my worst nightmare. Okay, I'm telling you.
We are so forgetful. Unbelievable.
You know why? Because there's too much in work. That's why. When your mind is like more clear,
Yeah.
you remember faster.
Yeah. Okay, guys. Now let me go quickly. Down syndrome. I'll just quickly go over it because it's important. Okay. Down syndrome, trisomy. I'll go 5 minutes on each, and then we'll go to the other diseases. So we have Down syndrome, and then we have Edwards, and Patel. Okay, so we said this is because of non-disjunction, right? Well, first of all, we see this trisomy. It's trisomy 21. Trisomy 18 is Edward. Trisomy 13 is Patel. So first you have to remember that part. Okay, very easy. The cause of these trisomies are change into blue color, and that will be non-disjunction. Disjunction. Okay, so non-disjunction is number one cause for all three of them. You can also have translocation. What produces these trisomies is non-disjunction in translocation. Okay, I'm not saying what causes Down syndrome. I'm saying what causes trisomy. Translocation causes trisomy. Non-disjunction causes trisomy. And mosaicism. 3 causes of trisomies. But if it's trisomy 21, you will call it Down syndrome. If it's trisomy 18, Edwards. And 13, so forth. Okay. Now, major problem or sign or symptom or defect that comes from trisomy 21 is mental retardation. Is it a new term for that, or we still use the mental retardation? Yeah? Okay. All right. So cardiac defect, heart defect. Okay, so let's say cardiovascular defect. So ASD, VSD, and PDA. But of course, ASD is the most common one, especially which one? Septum primum. Septum primum ASD. Septum primum ASD is more common. Okay. Now, of course, facial appearance issues, appearance-wise, they will have what? Macroglossia. Okay. Low set ears. Flat nasal bridge. So I don't have time to write all of those. Flat nasal bridge. Wide apart eyes. In the upper corner, the outer corners are slanted upwards. What's simian crease? Simian crease in the hand. Okay, so you see it should be joining, not three or four lines. It will be one big one joining. Okay, that's called simian crease. Okay. Epicanthal folds. What's that? Very good. The eyelids don't even close properly. They're usually like spread. Okay. All right. What else do I need to know? Cleft palate, cleft lips. All of these are common. But let's go to complication. Complications are usually what's tested.
What's nuchal translucence?
Which one?
Nuchal translucence.
Knuckle or nuchal? Knuckle. Yeah, it's probably knuckle. Maybe it's misspelled. Where is it? Let me see. Once I see it, I'll remember. Yeah, that should be knuckle. Knuckles translucency, the skin in the fingers is translucent. Okay, sometimes also right here, the skin in the back of your neck.
Okay, so it's not
Yeah. Okay. So the skin in the back of the neck is thick and it's translucent, especially that's during fetal development. So it's usually a sign for trisomy defect. Alzheimer's disease. Alzheimer's disease. Okay, so they'll get early onset Alzheimer's. They'll get leukemia known as ALL, acute lymphoblastic leukemia. They are at risk of duodenal atresia. Duodenal atresia. Duodenal atresia. All of this is in your book, so I'm using abbreviation just to save me time. So complication, Alzheimer's disease, early onset Alzheimer's disease, acute lymphoblastic leukemia, duodenal atresia, and other GI defects, maybe anal atresia, maybe Meckel's, a lot of things, but duodenal atresia is the most common one. Okay, annular pancreas, for example. So look, a lot of congenital defects are likely to occur in Down syndrome, a lot of them. But you will focus on the mental retardation, facial features, and heart problems, and then everything else comes fine. In Edwards, we talked about prominent occiput. Okay. And clenched fingers. Okay, so that's how you identify it. Yeah.
Sorry, one guy found in the book says they're saying it's maternal age, is maternal more common though? Is it
Maternal. If it says paternal is more common, that's wrong.
No, it just says paternal age. It doesn't say involved.
Yeah, so paternal age is involved, but number one risk factor is maternal age. Advanced maternal age. Huh?
It says parental, not
Parental, no, it's
parental.
Yeah, so it's not paternal. Yeah. It's okay. Okay. But make sure you're right, that's good. Because when you say parental, sometimes students will assume
It's both.
it's both. So I thank you to you, Muhammad. That's good. Let's write that maternal is more common. Yeah. Okay. Because it is parental, but when you say parental, you're gonna think both are even. No, it's not. It's not. Okay. So maternal are more likely for, of course. Okay. Okay. So prominent occiput, clenched fist or fingers. Now in Patel, what do you have? What are the conditions? Polydactyly instead of clenched fist. Polydactyly. Okay, anything else with P? Proencephaly. But let's say, I'll just write pro and then, but please, you're going to add what? Very good. Proencephaly. But I'll put here halo just to remember that. I use P just to remind you, but I know it's haloproencephaly. Make sure you know it's haloproencephaly. Failure of the cerebral hemisphere to segregate or separate into two left and right lobes. You'll have one brain fused together. Both of them will have, I'll use green for that. So this is how you differentiate between them. Both of them should have cleft lip or palate. Both of them will have rocker bottom feet. Okay. Both of them will have cardiac defect, let's say ASD, VSD, and PDA. By now you know all three of them. But of course it's more common in who? In Patel. All of them are more severe in Patel. Patel will always have cardiac defects. I think almost 95-96% of them usually would have cardiac defects. So okay, so look for these signs to help you. Okay, so that's for this. Let's move on to other diseases. Okay, so we will have, let's say, Klinefelter's disease. Okay, Klinefelter's disease. And then we have Turner's. Okay, can you tell me the pages as well? 109? And Fragile X syndrome. Okay, so what else do I need to put here? Let's include one more. You know, when people chat while they're crying, there's a disease for that too. Cry to chat. Yeah. I'm serious. They chat by crying. They communicate by crying. But anyways, I'll tell you. It's a French word. French word. Cry of a cat. Yeah. Fragile X. Fragile X. FXS, Fragile X syndrome. Klinefelter's, KFD, JFK, Turner's, Fragile X, and Cry de Chat. Okay. Now in Klinefelter's, again, what's the issue? You have 2 X chromosomes instead of 1 in a male. So it's XXY. It's still a trisomy, but it's trisomy sex chromosome. Or you can call it disomy X with a Y. In female, disomy X is normal. In men, it's not normal. Okay? And you can have 3 X chromosomes. The bigger the number of X chromosomes in a man, the more severe conditions become. If you have 3 more X's, it's worse than 2. 4 is worse than 3. And 5 is worse than 4, and so forth. As long as somebody has Y chromosome, it doesn't matter how many X chromosomes you have, it wouldn't change the gender. See, gender depends on what? Y. Y on Y. Okay. Y chromosome. See, Y chromosome codes for what? SRY gene, which is testicular gene. Very good. So you have Y chromosome, you automatically will develop testes. If you don't, you won't. So gender depends on what? On Y chromosomes. If any human beings or fetus has Y chromosome, they will have the SRY gene, which codes for what? Testes. And if a person has testes, they will produce what? Testosterone and MIF. 2 things are produced by the testes: MIF and testosterone. Testosterone will allow male genitalia to develop. MIF will prevent female genitalia from developing. So remember what testes does. It prevents female development and it promotes male development. So it's not a number of X chromosomes. It's the lack of Y that will make you female. In the presence of Y, that will make you male. Done. Simple, straightforward.
Could it be like that they have Y and still defective somehow?
Yeah. I'll tell you. Yeah.
I have a question. This came up like 2 years ago. What would the chromosomes look like if a person would have both?
If it had 2 Ys,
What like hermaphrodite?
hermaphrodite. Chromosome will look the same.
Would it the same?
Let me see. Hermaphrodite can have different causes. It could be at the chromosomal level. Okay. It could be at the receptor level. I think I did it yesterday, but let me just quickly do it one more time. I'll do quickly one more time. Let's say this is male and here is a female genotype. Make sense? So what makes whether you have testes or not is the lack of or presence of Y chromosome. See, on this side, this person has Y chromosome, so they will develop testes. When they develop testes, and testes, you know, produces testosterone. And they will also produce MIF, Mullerian inhibitory factor. What is Mission Impossible? I don't know, I had another name for it, like it sounded like Mission Impossible something. Mission Impossible 4. Okay. I don't know. Okay, so now, there's the thing. If there's no Y chromosome, automatically, by default, every fetus is supposed to become female. Remember that. By default, we are supposed to become female unless there is presence of Y chromosome or testosterone or testes. Otherwise, by default, what will happen? We'll become female. Let me show you an example. Okay, so if you have this, that means the person will develop what? Ovaries, right? With the fallopian tubes. Okay. Now, ovaries produce what? Estrogen. They don't produce testosterone and they don't produce MIF. Okay. Now we have 2 ducts. In an embryo, there are 2 ducts. Okay, 2 sort of tissue. One of them is known as Mullerian duct, a pair of them. Mullerian duct. Okay, I'll put M next to it. Mullerian duct. And then, oh, that's not good. Let's make that Wolfram duct, because I know some people say blue is for men, pink is for who? Who's pink for? Color? For girls. Why are you guys so shy? Just tell me it's girls. So pink is the Mullerian duct. Pink is the Mullerian duct. Blue is the Wolffian duct. Both ducts can exist at the same time in the early fetal development. Are we good so far? Okay. Mullerian duct will become female genitalia, internal and external. Mullerian ducts will become fallopian tube, uterus, and cervix, and upper 1/3 of birth canal or vagina. That's Mullerian duct. Whereas Wolffian duct will become vas deferens, okay, urethra, penile urethra, and so forth in some glands. Okay, so Wolffian duct cannot become female reproductive system. Each duct has different destination. Wolffian duct, wolf, will become male reproductive system. Mullerian duct will become female reproductive system. Are we good so far? Okay. Now, MIF stands for Mullerian inhibitory factor, which means MIF will cause degeneration of Mullerian duct. And the only organ that produces is what? Testes. So if you have testes, the likelihood of Mullerian ducts to grow and develop is impossible. It's mission impossible. Okay. Testosterone. See, MIF will cause what? Degeneration of Mullerian duct. Who does that? MIF. Okay, that's what MIF will do. Now, testosterone promotes growth of Wolffian duct. So I'll put a plus sign by testosterone, negative sign by MIF. MIF inhibits growth of Mullerian duct. It prevents female reproductive system from developing. Testosterone promotes development of male reproductive system, and both of them are produced by testes. So if a person has testes or Y chromosome, obviously the production or the development of female reproductive system is not going to occur. Good? And the production of male reproductive system will occur. Are we good so far? Okay. Now if you don't have testes, there's no MIF. You cannot prevent growth of female reproductive system. There's no testosterone. You cannot promote growth of male reproductive system. So naturally what would happen? You'll become female. I hope you understand what I'm saying. Now let me go to hermaphrodite, because that was your question. Okay, so now I'm coming to that. Let's say in cases, now testosterone needs a receptor. It's known as the androgen receptor. So that means Wolffian duct should have this receptor on it, right? Without the receptor, testosterone cannot even attach and stimulate this duct. But there are people, there are some fetuses, they will have receptor deficiency. If they have receptor deficiency, what happens? MIF will cause degeneration of what? Mullerian duct. And lack of testosterone will lead to what? Degeneration of Wolffian duct. At the end, you have no male characteristics and you don't have female characteristics. You have testosterone, but it's not able to open the doors. The lock is not there for it because testosterone acts like a key. So as a result, you will have internal organs, no uterus, no fallopian tubes, no ovaries, but externally you will have testes. But testosterone is required for growth of penis. So these children will have testes, but will have a blind vagina. And the clitoris will be small. It wouldn't grow. So that's one way. As I said, depends how we look at it. Now let's look at it differently. Genetically, this is male. They have testes. Phenotypically, they're what? Ambiguous genitalia. Okay. So now let's go to the opposite side. In this case, it's XX chromosome genetically. That means these fetuses don't have testosterone or MIF. Very good. So if you don't have MIF, what will happen to Mullerian duct? They will grow and they will fuse and they will become what? Uterus, cervix, 1/3 of vagina, and fallopian tubes. Ovaries are based on the X chromosome. Okay, so it will develop into that. Now, but there is ovarian tumor known as theca cell tumor. So the ovaries can produce testosterone sometime if it's cancerous. And this testosterone will cause growth of what now? it will maintain Wolffian ducts. So Wolffian duct will grow, and they will have vas deferens as well, and they will have enlargement of clitoris as well. So now you have a female genitalia and male genitalia at the same time. Okay, so there's different variety, depends what happens. Possibilities are there, and in real life, yes, there's 3 examples of each of these situations that I talk about. By far the most common one is testicular feminization syndrome, meaning the fetus will have, or the child will have testes, but will not have testosterone receptor, so they will be phenotypically female. Genetically male, they have testes and they have XY chromosome. Phenotypically they will have enlarged breast, and they will have no birth canal, only the lower 1/3. Okay, and they can do through surgery. Gender identity comes, I believe, you know what, like, I mean, you see, when you learn something is different, and when you experience something it's different. So I didn't, because I never came across like cases of these during my training, but when I see my son growing, he has gender identity since the first time he realized, I mean, this is funny, but when I realized that he has gender identity was, I think, about 16, 17 months. I was taught it's 3 years. I was taught it was 3 years. That gender identity, children will know they're girl or boy by 3 years. But I think my son knew at 16 months. That was crazy. That was a surprise to me. So he knows. So when it comes ethically, when the child comes 3 or 4 years old, then you can make a decision whether they want to stay male or female. So you can do enlargement of vaginoplasties. You can enlarge vagina to make it actually true female, or if it's clitoris, you can introduce them to testosterone. Hopefully it will enlarge and become male. Depends what the parents want for that age. I think there's a lot of ethical issue with that, because can parents make a decision on their child's behalf? Because children wouldn't know until 11, 12 what's good for them, what's not. They really cannot make that decision. So there's still a lot of debate going on back and forth. But the earlier you do, the better it is, because they won't have confusion. You know, they will not have confusion, and they will grow as male or female. If you do it later on, they will say, oh, I didn't want that. Like that guy from Hollywood, Bruce Jenner's, whatever. Yeah. Okay. Sometimes freedom is not good, because people do crazy things to themselves, right? So, but it's up to. So XXY is Klinefelter's. Turner syndrome is XO. O stands for no X chromosome, one X chromosome. It's monosomy. O stands for 0. XO, there's no such chromosome called O, right? You either have 1 through 22 or X or Y. Okay, so that O stands for 0. That means they lack, these are females, but they lack 1 X chromosome. They only have 1. They should have 2. Females should have 2 X chromosomes. So that's become a condition.
What female? Can be what now?
In men, no. In men,
Why is the absence?
yeah. In men, if you have 1 Y chromosome, you have 1 X, it's normal. In female, when you have 1 X chromosome, it's abnormal. Female is supposed to have how many X chromosomes? 2. Man is supposed to have 1 already anyways. So if they have 1, it's normal. If they have 0 X chromosome, then it's a problem. Okay, such thing, I don't know if it exists. I don't want to tell you something. I think there's no fetus or child that is only Y without X. I don't think, because X chromosome has how many genes on it? A lot. Y chromosome has only 1 gene for testes so far. So X is essential for survival. Y isn't. Unfortunately for you men. You know when they ask you the question, who came first? Chicken or egg? Maybe you can debate that. Who came first, male or female?
Male.
Okay. For sure. Yeah, that's fine. That's fine. Okay, fragile X. Fragile X. This is X chromosome. A part of this X chromosome is weak. It's fragile. Okay, so the X chromosome is fragile, means it breaks easily. And this is because of increased methylation. The area of the X chromosome is hypermethylated. and it becomes fragile, and it can bend, and it can break, it can cause problems. That's almost like inactivated X chromosome anyways. So part of the X chromosome is inactivated. And in female, fragile X is not a problem, right? In female, fragile X, yeah, she has another copy. In men, it's a problem. So we'll use the genotype for men. Kraidish Shat. Anybody French here? No? Algerian, Moroccan. They can speak French, right? Canadians. Who's Canadian?
Lebanese.
They're Western Canadians, not Eastern.
Lebanese as well.
Yeah? What does Shat mean? Cat. How is it pronounced in French? Rama thinks she knows French. No. How do you pronounce Chat? Shah. Cry du Shah? Qui du Shah? Qui du Shah? Qui du Shah? Okay, you guys figured it out.
Let's not make debate on that.
Yeah. It's chromosome 5 deletion. Chromosome 5 deletion. Now, you know deletion can be one nucleotide, could be 2, could be 3. In this case, it's a huge chunk of it. Majority of chromosome number 5 is deleted. That's why it's a problem. Okay, majority, a lot of chromosome, a huge chunk of it is deleted. So,
How many nucleotides?
I don't know. That's what I'm saying. It's a huge chunk. Yeah, maybe 1,000. I don't know. I can look it up. Yeah. Okay. At the end of this, so you're like, that's good to know because this can be on the exam. But what's the big deal? In Klinefelters, I want to compare fragile X and Klinefelters. In Klinefelters, these men have too much X chromosomes, right? So they'll appear more phenotypically like who? Female. So they will have enlargement of breast. What's the term for enlargement of breast? Good job. You know there's that one movie where the whole 9 yard or something? And one of the person puts estrogen for this because they're all in prison. I think they work out. One of them put estrogen in this. He starts developing breast. That's true. Yeah, that's gynecomastia. So gynecomastia. How about testes? Small. Okay, so testes will be small. That's known as testicular atrophy or hypogonadism. Okay, hypo means small or less. Gonadism. Gonads is a term for testes or ovaries, but in this case it's male, so means small testes. Okay. How about sperm production? Do you think that's affected? Yeah. Azoospermia. Azoospermia. Sperm production is decreased, and whatever is produced could be defective as well. So now let's ask Muhammad, if they have azoospermia, what do you expect, Muhammad? Infertility. Excellent. Infertility. Yeah.
Dysfunction.
Yeah.
So decrease longer than time.
Okay. So mostly these men are infertile. Okay. So again, gynecomastia, small testes. Okay. And what else? Azoospermia, we said infertility, right? And they can have long limbs. Long limbs. Not trunk. Trunk is normal. Limbs are longer. Okay? Almost like Marfan's patient. Yeah. Yeah. Now, we're not talking about like when you see symmetrically tall person, no. So there's disproportion in terms of the trunk and limbs. Okay? Alright.
Wait, you said they're phenotypically considered female?
No, they're not considered female.
Phenotypically female or male?
No, they're men. They're men. Genotypically they're men, phenotypically they're men. Okay? They will have testes. They will have testes. Guys, don't confuse this. They still have Y chromosome. They will have testes. They have no problem with testosterone. They will have penis. They will have all male external genitalia. The only thing is, in terms of skin, smoothness and beautiful skin, they will have it. They will have less facial hair, for example, or no facial hair. Okay, they will have less facial hair or no facial hair. And they will have smooth voice, for example. Okay? They'll have enlarged breast. Okay? but these are not always there. Okay, so there's not much difference. It's just, yeah.
I have a brother that's like this. He don't have the man boobs, but he don't got arm either. My brother don't grow facial hair at all.
Okay.
No body hair, no nothing.
Okay.
Smooth skin.
Yeah. She's not Klinefelter's. Yeah. To your surprise, you cannot bug him anymore. I feel bad. But there's the thing. Let me tell you a story. You know, when you're a student, when you're learning, you have to be flexible. You don't take this immediately that whatever I tell you is always there. Let me tell you a story. So I was helping a friend of mine with step 2 preparation. We're both studying. This was in Emory in Atlanta, and he's Afghan too. So his aunt has died of ectopic pregnancy. He's like, help me with step 2 preparation. So we're sitting in Starbucks and I'm helping him and teaching him. And when I taught him that PID, pelvic inflammatory disease, is STD, his face turned red. Once I told him ectopic pregnancy is a complication of PID, and PID most of the time is gonorrhea and chlamydia. Gonorrhea and chlamydia causes PID, pelvic inflammatory disease, and a big complication of that is ectopic pregnancy. Surprisingly, just about 10-20 minutes ago, he had told me a story that his aunt died because of ectopic in a hospital. Now, when I'm telling him that this condition is the major risk factor is STD, and him being culturally sensitive, he turned so red. He immediately made a connection that his aunt must have had an STD. But no, it's a risk factor. It doesn't mean that everybody who goes through ectopic would have PID. No. So just because these characteristics are true of Klinefelter does not mean everybody who has certain characteristics will be Klinefelters, or vice versa. So you have to be very careful with that. Okay? Unless you do karyotyping. Karyotyping is when you take a picture of a cell in the metaphase. Okay, when do chromosomes lie exactly in the middle? Metaphase. That's the only time you can see them separate. Otherwise they'll be twisted and all around like spaghetti all over the plate. So that's the only time you can take a picture of chromosome and count them, and to see which chromosomes are, like duplicated, quadruple, or 1. Because homologous chromosome will what? Pair up. So during metaphase, you will take a picture, and that's known as karyotyping. And for this, you have to freeze the cell in that stage because it goes too fast. And you have to use colchicine. You use colchicine to freeze the cell in the metaphase, and you take a picture and you count the chromosomes. If you see XXY, then you know this is Klinefelter's. If you don't see that, they can have all the symptoms. I mean, these days, feminine characteristics in men are increasing, especially because especially in certain states, because they promote that. They think this is a different version of lifestyle and whatever, which they have the freedom to do so, but it doesn't mean they choose to do so. They do not have any defect in their genes or chromosomes. Okay, so people can acquire. Some people are just environmental. There's a lot environmental influence in terms of feminine characteristics or female having male-like characteristics. A lot of environmental, more than genetics. Genetics is rarely involved. Rarely. See, conditions like Klinefelter's are 1 in 100,000. Okay, extremely rare. Condition like Turner syndrome, extremely rare. Fragile X, extremely rare. Cry-du-chat, oh my god, very rare. You don't see them that common. But if you start counting homosexuals or who talk more feminine, like you just go to boys' towns, there's tons. You go to San Francisco, tons. You go to Georgia, oh my god. You go to Miami. I mean, I'm saying there's a lot of them, so it doesn't match. These are environmentally, they're willing to change their own thing for their own purposes, whatever feelings they have. Okay, so that's a different thing. That's a choice. This is not a choice. These are mistakes in genetics. They're extremely, extremely, extremely rare. And the basis of evolution is only those who are fit to survive will live. Those who are not fit, they will die. So mutation usually leads to what? Those mutations that leads to defects, they don't live. We just discussed this. Number 1 cause of spontaneous mutation is what? Spontaneous abortion is chromosomal problems. So any chromosomal problem that's devastating don't survive, and you don't get to see them grow. Okay. All right. Good. So Klinefelter's. Now let's do Fragile X. it's still a male chromosome, right? This is genotypically male, this person or this patient, but they have an X chromosome that's slightly methylated or inactivated. That means they should be they are actually tall as well, but they will have enlarged testes, not small. They will have large testes. They will have large jaw, macrognathia, macro, large jaw. Okay, I don't know if you guys watch UFC. Any of you, if you watch UFC, you know the martial arts. There's somebody called from Brazil, Bigfoot. So he probably has Fragile X syndrome. Okay. All right. So macrognathia. Meaning protruding chin, large chin. Okay. All right. Second most common cause of mental retardation is Fragile X. Don't forget that. The second most common cause of mental retardation is Fragile X. Okay. So again, they will have, for example, disproportionately long arms and legs compared to their trunk. Okay, unlike achondroplasia, which was short arms and legs compared to the trunk. And here you have long. Okay, so both of them are men. Easy to differentiate. One has small testes, one has large testes. Okay, both will have infertility. Okay, both will have infertility. But Fragile X has mental retardation. Yeah.
So chromosome X is methylated or demethylated?
Methylated. Methylated.
Which is abnormal.
Which is inactive. Yeah. Methylation, please write this down. Methylation means inactivation of genes. Whenever you want to inactivate, turn off genes, it's methylation. The signal for turning off a gene, making it silent, is known as methylation. To give you a physical example, Sam, give me a chance, then I'll come back to you. To give you a physical, so how you can picture that. Let's say this is a gene. Remember, genes should have promoter, operator, and regulator, right? Okay. Remember, polymers like planes or shuttles, they have to come and land on this runway called promoter and attach to them, right? So if you have trees, methyl group are CH3. They're bulky groups. If you keep growing these huge trees, bigger than Christmas trees, on your runway and on your roads, nothing can pass through. It physically covers the gene. It's inactive. You cannot transcribe it. You cannot copy it. That's what methylation does. They're bulky groups. So it prevents polymerase from reaching there. Okay? All right. Sam?
I got it. FXS, you said, had long extremities, normal trunk.
Yeah.
So like Marfan, but
Yeah, very much like Marfan. Okay. Now, in Turner syndrome, this is female. See, in female, all females should have 2 X chromosomes. Okay, all female will have 2 X chromosomes. One of them is randomly inactivated. At the end of the day, men have how many X chromosomes? 1. Female should have, but they're functional, right? That means you need only 1 X chromosome for functionality. You need only 1 X chromosome for functionality. If female have both chromosome X active, they will have defects. So one of the chromosome is methylated randomly or deactivated randomly. So at the end of the day, female also will have 1 active chromosome, 1 inactive chromosome. And the inactive chromosome is called bar bodies. Bar body, because it shrinks and clumps together. Bar body. So when you do karyotyping for female, when you see chromosome number 23, you will have 1 large X, 1 small X. Okay, Y is much smaller than X because Y has no genes, right? So you can differentiate between them. So let's say, in this case, this female has 1 less chromosome, and then parts of the genes on the other X chromosome are slightly inactive. That means at the end of the day will cause some defects. So one thing is the ovaries are small, very small. They're known as streaky ovaries, streaky. Meaning when you do CT scan or X-ray or ultrasound, you don't really see ovaries, you just see a line. That's where the terms come from, streaky ovaries. They're extremely small. That means they're atrophied. They're not functional. So ovaries in female are atrophied. What do they produce? Estrogen and what else? Progesterone. And what else? Inhibin. Let me write it down. So ovaries will produce 3 hormones: estrogen, progesterone, and inhibin. Okay, inhibin. In this case, if there's no developed ovaries, that means there's lack of estrogen, lack of progesterone, lack of inhibin. I mean, they have different functions. Let's not discuss it now because that's not the time. We'll do this in the reproductive system. So number 1, these 3 will be decreased. 2, pituitary produces hormones known as LH and FSH, which are negative feedback inhibited by who? Estrogen and inhibin. If you don't have estrogen and inhibin, what happens to LH and FSH? They'll be increased because there's no negative feedback. No negative feedback. No negative feedback. At the end of the day, estrogen is required for what? Fertility, ovulation, menses, breast development. If you have no estrogen, what happens to breast? Small. Male-like breast. Female will have male-like breast. And usually the term is used, you know, shield-like chest. And this term is used, you know, those back in the days in the sword fighting times, they will wear the shield. So, and they will draw those breasts on them. That's exactly what you will see. Okay? So, shield-like breast. That's where the terms come from. Okay, so you can say male-like breast. Male-like breast. That's the appropriate term. But I guess there was a female scientist with a male scientist. She didn't like the term, so she said the shield is better than male-like breast. But who knows? Now, small breasts, small ovaries, no estrogen, no progesterone, no inhibin, but too much LH, too much FSH, which can lead to pituitary adenoma. If there's no negative feedback on pituitary, that means pituitary can actually grow in size, potentially. Okay?
I have a question.
Yeah.
So you said only one X is active, right? Whenever we talk about X-linked diseases, we always tend to focus more on males getting it. So what if the...
Excellent question. See, you're thinking. You're thinking. Well, you know, when a female is a carrier, methylation or inactivation of the defective chromosome usually occurs, not a healthy. It's crazy. Yeah. It's crazy, but it does. Now in men, if they get the defective chromosome, they only have one. So you cannot inactivate it. But in female, the deactivation has some process to it. Yeah.
With the small or with the decreased estrogen and progesterone,
They will have no menses. No menses. Yeah. Primary amenorrhea. Primary means she never had a period. She never had a menses. That's primary. Secondary means they had it and somehow it stopped. Maybe she started taking birth control pills. That's secondary. Primary, she never had one. So they'll have primary amenorrhea. They have small ovaries. Okay. Okay. Also, they'll be short in stature. They'll have web neck. What is web neck? Shoulders slightly elevated, short neck. Okay. Okay. Complication of Turner's are more important. Turner syndrome. They are at risk of developing coarctation of aorta. Coarctation of aorta. You can finish the sentence. Coarctation of aorta, which is a major artery, the largest, biggest artery of your body. Comes directly from left ventricle, right? Coarctation. What does arch mean to you? Arch or arc? Noah's arc, arch, curve. So aorta is, if this is a heart, I mean this is a heart, not if, because I wouldn't deceive you. And here is the aorta. Okay, So this is normal. Now, if a part of aorta gets constricted, narrow, this is known as coarctation. Aorta is being arched. There is an obstruction or narrowing. This is coarctation of aorta. Very common in Turner syndrome. But the coarctation occurs in the arch of aorta, not in thoracic aorta, not in abdominal aorta. And all of you know that. Aorta will become abdominal and will split into common iliac. It will become external and internal iliac. External iliac will supply your legs. Internal iliac will supply your pelvis, okay, and perineum areas. That means if you have an obstruction here, so aorta will here gives you common carotid, right? And it'll give you brachiocephalic, very good. Okay, and brachial artery, so we'll give you these arteries. Now if coarctation occurs here, if it occurs here, that means it occurs after the arch of aorta, where it gives you three major branches. So brachiocephalic, brachio means arm, cephal means brain. So brachiocephalic supplies the brain and arm, and the brachial artery supplies the arm. So that means there's increased blood flow now where? In the upper extremities. And decreased blood flow where? In the lower extremities. Immediately. How to identify this patient? You check pulse and their feet compared to pulse and their arms. Pulse in the arms is increased. Blood pressure in the arm is increased. Blood pressure and pulse in the legs and feet are decreased. And feet will be cold to touch. Arms warm to touch. And they will have hypertension. Where? Only the upper extremity. Hypotension in the lower extremity. Hypertension in upper extremity and brain. So if you have too much blood coming to the brain, you will have headache, confusion, and maybe blurry vision. So, okay. That's coarctation. Again, we'll discuss them in cardiology. You know, but just in case you're curious, like what is coarctation? Okay. So they're at risk of coarctation, Turner syndrome. They're infertile. They have amenorrhea. They will have no menses. No menses. They have no egg to donate. So no ovulation. No fertilization. No menses. Menses, no. Remember, menses has nothing to do with, in a sense, with ovulation. Menses has to do with uterus. But for uterus, the endometrium to grow, you need estrogen and progesterone. And you don't have them.
They will never have it.
Never. Yeah. But what you can do, when these female are about to hit puberty, what age is that on average for female? 11, 12. You can start them on hormone therapy. You can start them on hormone therapy. We don't care for LH and FSH. We care for what? Estrogen and progesterone. So you give them estrogen and progesterone. So what will happen? They'll develop normally. Yeah, they'll be normal.
So they just need a hormone replacement.
They'll still be infertile because there's no egg to ovulate. But at least they will have menses, they will have normal growth and so forth. Yeah. What was your question?
Oh, so they just need a hormone replacement.
Yeah. Now when it comes to, see, female who are exposed to high concentration of estrogens alone are at risk of breast cancer, endometrial cancer. So you have to make sure that you give them balanced estrogen and progesterone together. Turner syndrome patients are at less risk of breast cancer and endometrial cancer. Unless you do hormone therapy, then they're at the same risk as everybody else. Okay. Okay, cry du chat. Yeah.
I have a question. So for Turner's, is the X chromosome normal, and then it's just the O that's kind of making it?
Yeah. So there's one copy that's missing, and the only copy you have, it's not completely active. So at the end of the day, you get less product. Yeah.
But it's still normal though, right?
Yeah, of course it's normal, yeah.
What if like the X chromosome was like kind of diseased as well as the O?
If it was defective, then it'll be severe symptoms. Yeah. So that means you can have, for example, all those genes that are located on the X chromosome deficiency. So you could have hemophilia, you could have glucose 6-phosphate dehydrogenase deficiency. Just two of them that comes to my mind. They're X-linked. Lesch-Knahan syndrome, which is X-linked. Anyway, so all those X-linked disease will appear. X chromosome has a lot of genes on them. They're essential for survival, right? So if you don't have X chromosome, we're in trouble. They usually won't survive. Now there's some chromosome of ATP synthesis. I mean genes, sorry. There are some genes that are required for ATP synthesis, energy production. They're located on what? X chromosome. So if you don't have any X chromosome, I don't think survival is possible. That's why there's no patients discovered or alive who has no X chromosomes. They don't live. Okay. Okay, cry the chat. The only thing about that is, no, please know that there is possibility of mental retardation, cardiac defects, but how you identify it, they have laryngeal hypoplasia. Larynx. Larynx is the voice box, produces sound. Laryngeal hypoplasia. What does plasia mean? Growth, increase in number. Hypo means less. So there is no growth of larynx and it stays small. As a result, when these children, they talk as if they're like a cat is meowing. Meow, meow. They say hi. You know, like, yeah, so they will have this sound. That's why it's called cry of a cat. The name refers to cry of a cat in French. Cri de chat, that's what they say. Okay.
You said possible heart defect or whatever.
Yeah. Okay. Okay, let's take a break.